So I flew back to Vermont, got my treatment. My oncologist was wonderful and very sympathetic and knew there was nothing he could do to help me get treatment down there, which we tried to do. My social worker tried to help me. My nurse tried to help me get it down there. Couldn't work. Throughout this experience, I'm fortunate to have a team assigned to me at Fletcher Allen. They've helped me with health-related insurance issues in a big time. But I have to wonder about how many people throughout Vermont don't have this kind of advocacy. I know they don't. And luckily I have had it, but it's also still, even though I've had it, it's been extremely stressful. I've had my social worker, the healthcare ombudsman, I like to say ombudsperson, all had to advocate my treatment being covered. All of this money could be better spent on patient care and my nurses, doctors, social worker, and I could be talking about staying mentally healthy, physically healthy, and get the emotional support that I need. But instead, constantly on the phone with people that customer service representatives who you get frustrated with, and it's not their fault. You know, they're wanting to help you, but then you're like, I need to speak to a manager, and then they get frustrated, and I'm sure many people know this, and it's not a very pleasant system. So despite all of this, I still face problems. I forgot to fill out a piece of paper, and many of us know what those papers are. They come to you from VHAP or Catamount Blue almost every day, every other day, and you look at these papers and you go, and I forgot to fill out a piece of paper. This was last year, so I lost my coverage. So I panicked, and I thought, I have chemo, I have all this other treatment, what do I do? So luckily, with the help that I had, I was able to re-enroll and get the care, but the health ombudsman was wonderful, but she said, you didn't fill out this piece of paper. And I said, I know, but I'm getting chemo and my brain is not, you're not thinking clearly. So luckily, I got back enrolled, and that was okay. Well, I'm grateful to my oncologist. His schedules are about 7 minutes. So as many of you know, you go in, you see your doctor, I start feeling badly that I'm asking questions, which is crazy. Here I am, I've got cancer, I want to know this, I want to know that, drive them crazy, and they should have the time to listen to me make them crazy. And they don't. And it's not his fault. I'm constantly filled with questions about my treatment. And I don't think anybody should feel guilty about the time that they spend with their doctor. And I want to repeat that it's usually not the doctor's fault, but you take on, or at least I take on, knowing that they kind of glance down or they're standing towards the door, because they know they have another patient to see who's in just as much need as you are. Okay, I'm almost done. The bottom line for me and thousands of others is that whether you have money or you don't have money, whatever your circumstances are, you shouldn't have to worry about whether you're covered, whether you have health insurance. Under Green Mountain Care, our new single-payer system, this fear and stress will go away. And Vermonters will be able to rest easy, knowing they're covered whether they get sick, lose their job, spouse, or other life-changing circumstances. Because as many people know, when you're stressed, everyone around you gets stressed. And if you have a partner, that makes it's very difficult. They watch you suffering, and it becomes a sort of a whirlwind. Unfortunately, my cancer has returned. And just yesterday, I spent about 3 hours, and I'm glad I don't have a job, because if I had a job, I probably wouldn't have been able to do this. I spent 3 hours on the phone with VHAP, back to Blue Cross, back to NYU Cancer Center, and let's see, my nurse, and a few other people, some friends, and discussing how I was going to cover this next piece of trial down in New York City. Because my VHAP, I had to switch to Blue Cross Blue Shield, the Catamount Blue. And when I spoke to the health ombudsman, she said, make sure that they know about the Green Mountain Care when you speak to Blue Cross Blue Shield here, because they may not take that at NYU. And I was like, but I thought it was the same thing. I thought Blue Cross Blue Shield of Vermont and Catamount Blue were the same thing. She said no. Thankfully, I had her to sort of direct me to my next phone call. And that was about 2 or 3 hours on the phone yesterday. I missed my art class. Very upset about it. So now my next step is going to NYU for a clinical trial, which is very difficult to get into. Although the research hospital will foot the bill for the medical, my current insurance plan won't cover things like blood work, CAT scans, physician's charges, things I would be getting in Vermont. But this is my last chance at making it through some of this. So bills are not, I will pay out of pocket if I have to, but as we know, paying out of pocket can take years and years and years and years off your life. So I will move forward. Coverage restrictions, out-of-pocket expenses, paperwork, and processing are the result of our current healthcare system and have kept many of my friends, strangers, colleagues from getting the care they need. What I've realized is that until you face a lot of these challenges, you don't take action, which I know thousands of people do, thanks to Cassandra Vikas and many others. People do go and they take charge and they try to make changes. And for me, it was now seeing my illness, my mother's illness, that has led me to see how much more broken the system is than I actually thought when I did know it was broken. So, thank you to the governor, legislators, and advocates who passed this law, putting us on the path to a publicly financed universal health care system. It will make all this difference in the world to Vermonters and their families, whether they are sick or healthy. And we are all just one test away. Thank you.
Julie Lineberger is a business person in Windham County, an architect, and chairs the VBSR board. Thank you, Julie. Where are you?
Vermont, once again, is leading the nation in its tradition of independent thinking. We've done this many times before, with being the first state in the nation to ban slavery, to incorporate universal education, to enact civil unions, and then have marriage equality without a judicial order. We're also one of the first states in the nation to enact a socially responsible charter so that businesses can incorporate as a for-benefit corporation. Truly, this law we're signing today is more than a healthcare law. It is economic development for the state of Vermont. With an equal playing field, Vermont businesses can play on the global marketplace. When our businesses no longer need to spend 15 to 30% of their payroll on health insurance, we can invest back in more Vermont employees and higher wages. Vermont also leads the nation in a very special business organization that believes our success is measured not only by the dollar, but also in how we treat our employees, how we interact with our communities, and how lightly we walk on the earth. With over 1,200 business members, Vermont Businesses for Social Responsibility represents approximately 15% of our workforce. We are the largest, most active business for social responsibility in the United States, leading the way for others. As VBSR board chair, I am honored to be speaking today. For 20 years, we have it in our records, VBSR and a multitude of people have worked to decouple health insurance from paychecks. Who is it that decided that only those working for certain companies were worthy of proper health care? The law about to be signed is a culmination of many people's efforts. It's an example of how governmental bodies, nonprofit organizations, and leading the pack, businesses can work together to affect positive outcomes. Our nimble state of Vermont is making changes where other states waffle. Thank you, Governor Shumlin, for your vision, foresight, and commitment. Thank you, Dr. Deb Richter, for your endless, tireless energy and moving to Vermont, where one person really can make a difference. Thank you to all House Committee members who worked for balance to bring this to the floor under the leadership of Mark Larson. Thank you, Senator Claire Eyre of the Senate Health and Welfare Committee, leadership bringing this to the Senate vote. Thank you, House Representatives, and your Speaker, Shep Smith, for starting the ball rolling. And thank you, State Senators and your leader, Pro Tem John Campbell, for guidance through the Senate. This business community applauds you. The nation is watching you. With this law, you sure have created a lot of hard work for yourself, and everyone here is ready to roll up their sleeves and help.
Amen.
There have been so many advocates that have worked so hard for this bill: doctors, nurses, providers, business people, and labor, and so many others. But so it's a little dangerous to choose a few, but I do want to introduce now someone who did a tireless work on this bill, as did the organization, Cassandra Geekus with Beeper. Sandra.
Woo!
Thank you. And wow, it is such an honor to be here today. There are so many people to thank, but I'll try not to turn this into an Academy Award speech and thank everyone on my list. But most definitely have to thank Governor Shumlin, legislative leaders, and all the advocates who helped us achieve this, and I'm grateful to be here with all of you on this historic day. VPIRG is the largest consumer protection advocacy organization in the state. We represent over 30,000 members and supporters. And our members, like thousands of Vermonters, understand the failures of our healthcare system all too well. And we know that affordable coverage is still out of reach for thousands of Vermonters. The statistics that you've heard about growth in healthcare spending have made it clear that for Vermont, maintaining the status quo is just not an option. Change is necessary for the health of our families, for the communities, and for the state budget. And it's not just Vermonters that are excited about what we're doing today. Citizens, advocates, and decision makers across the country are watching us. First, because we're tackling a problem of cost control and universal health care that no one else has been able to solve in the country. Luckily, we have the resources, the political will, and the ground support to tackle this issue head on. And if successful, we will no doubt change the tone of healthcare discussions and the debate across the country, and help other states feel like this type of monumental change is possible. As many have said, this bill is a first step in a multi-year process, but one of the most important things we're doing here today is laying out a clear vision for where we want to be. And this vision for Green Mountain Care is something that I think most Vermonters are very excited about. Imagine a world where families touched by illness can focus on healing rather than losing sleep over whether or not they can pay their medical bills. Imagine a doctor's visit where you can spend more time discussing your treatment and health than you sit in the waiting room filling out paperwork. Imagine being able to face life-changing circumstances like job, marriage, or illness without being terrified that one sickness is going to send you into bankruptcy. It's really inexcusable that we live in a society where the good people that grow our food, that build our houses, support our children, still do not have access to health care. And I think Vermonters are really hungry for common sense solutions, for reasonable discussions, and straightforward answers to their health reform questions. And that's exactly what this bill does. That's what the governor has brought to the table and the legislative leaders, and we're incredibly grateful for that. So thank you again for the hard work of the governor's office, legislative leadership, advocates, and the thousands of Vermonters. You're the reason why we're here celebrating today. And we must continue down this path with resolve, ingenuity, and the compassion that has come to define almost everything that we do here in Vermont. And VPIRG is not only committed to the success of Green Mountain Care, the state's universal and publicly financed healthcare system, but we're committed to keeping Vermonters informed and engaged throughout the process. If we stay focused, keep our eyes on the prize, I'm confident that Vermonters will have this system. We will all have access to high quality, universal, affordable health care that we can count on, and that our little state can help turn the tide for the rest of the country. So thank you again for everything. It's an honor to be a part of this, and I look forward to both the celebration and the hard work ahead.